Are you recording?
Yep, recording now.
Hey guys. Oh, that was so nice. So pretty.
Thank
Looking
you.
good, girl.
Okay, back to the questions. And I'll take once it's over, before I stop the recording, I'll go over those first three again, and so that they're recorded in the recording so everybody has a chance to hear them. What are things done to prevent asthma attacks?
Avoid allergens.
Okay.
Avoid pets.
What else?
Avoid pets. Allergens, she said. That's
Yeah,
general.
allergens, that's
overall.
one way. But there's
What about
more,
the medications, the proactive medications that they take?
right?
But I don't know, like, I guess albuterol, is that one that they would take proactively, or is it the glucose?
Like
The
budesonide.
corticosteroids.
Yes.
Uh-huh.
But you want to make sure that they take their inhalers as directed. And you want to be able to teach the patient and the family about the green, yellow, red form that is out there. It's a great teaching tool because it tells them, okay, if you're green and you're a little bit short of breath and you take your rescue inhaler, that's going to help it. If it's yellow, you've already done the green step. Then you go to the yellow step and you take the other medication that the doctor has prescribed for you. If that doesn't help, then it's the red step, and that's usually calling the provider or going to the hospital. So
Okay.
it says children with asthma should be encouraged to exercise using moderation. They should not become extremely tired, and activities should be spaced to provide periods of rest. Statements about identifying allergens, triggers, using bronchodilators before steroid inhalers, and drinking water to thin the secretions indicate that the caregiver have an understanding of treatment important for the child with asthma. Okay.
Bill, can I ask you a question?
Sure.
Are you, did you make a study guide?
I've got it in my hand.
Yay, thank you.
And I'll post it after this is over with.
Okay.
So you guys will have it and the answers and all that kind of page numbers and all that kind of stuff.
Great.
What are the interventions that can be done for a child with cystic fibrosis?
Pain relief,
What's that?
pain relief, pain management.
Well, it's not necessarily the pain relief that they want.
Postural drainage.
The postural drainage is performed in the morning and evening.
Dietary changes.
Dietary changes can also help maintain
Fluid
your child.
intake.
Huh?
Increase fluid, regular fluid intake.
Correct. High protein snacks will help increase caloric intake. Children with cystic fibrosis need to be protected from infection, but do not need to be isolated
Right.
like the rest of us are right now.
Right.
And that's on page 754 in the book. With a child with sickle cell disease, what are some important interventions that need to be done during a crisis?
Oxygen therapy.
Okay, but what's more important than that?
I don't know.
What's the number one thing that a sickle cell patient has? What brings them into the hospital?
Pain.
Anemia.
Pain.
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 Oh, that's good, Hannah.
Because those little sickle cell blood shapes, they get caught in the joints in the smaller blood vessels, and it stops the blood flow and it causes severe pain. Making sure that they take in about 2,000 to 3,000 milliliters of fluid a day will also help by keeping them well hydrated. Okay.
Well, Thank
But
you.
pain is the #1 intervention.
Yes.
And that's on page 775. I jump around with this, but that's, what nursing priority would you expect for a child with sickle cell disease? And it's pretty much the
that
same
pain?
thing we just talked about.
Okay.
Okay, it's treating the pain promptly, providing family support, monitoring for skin breakdown, and moving the extremities gently are interventions appropriate for the family and child with sickle cell disease. Okay, but they wouldn't be the highest priority. The highest priority is the pain control. Okay, now we're switching over to a patient with hemophilia. What are the ways of stopping bleeding for a child with hemophilia?
Can you ask the question again?
What are the ways to stop bleeding for a child with hemophilia?
Ice?
It says here, it says when the child with hemophilia has a bleeding episode, the child is placed so the area of the bleeding is raised above the level of his heart when possible. The caregiver statement that they should elevate his feet, leave his feet down is wrong. Putting ice on it, direct pressure, keeping pressure on the injury site and using splints to limit bleeding are all measures to stop bleeding when the child with hemophilia is injured and indicates that the caregiver understands the instructions.
So, Bill, what medications is it like a platelet therapy, or I mean, like what prevents it? You know, like, I mean, I know there's yeah.
It depends on what type of hemophilia they have. There's hemophilia A and hemophilia B. They're both with clotting factors. One's factor 8, one's factor 9. And it slows the response of the body because they don't have those factors to increase the clotting ability of the blood. So the direct pressure, the splinting, raising legs above the level of the heart if they can. Putting ice on it because ice constricts the blood vessels and controls bleeding. Okay. It's sort of like my hands right now. My hands are freezing cold because I'm upstairs in my bedroom.
Wow.
And I tried to poke my blood. I had to poke myself like 4 times to get enough blood to get my blood sugar. So it's because my hands are so freezing cold. Okay. So that's the stopping bleeding with child with hemophilia. What else? Yeah. Somebody said something? No. Okay. What are the signs and symptoms for a child with leukemia?
Like bruising and pain, like getting colds easily, right?
Not usually. Not
Nausea, vomiting?
Bruising easily.
Well, what it says in the book is low-grade fever, bone and joint pain, fatigue, pallor, petechiae, and purpurea are signs of and symptoms seen in a child with leukemia.
Can you tell me what page that's on?
That's on page 781.
731?
81.
781.
I saw him with a jacket. I don't know if he went. Did you see Scout outside?
And then for the
Maybe.
for hemophilia, it's 777.
777. Okay.
Yeah, for hemophilia.
Thank you.
What is the highest priority for intervention for a child with leukemia?
Infection, or like make sure they don't get infections.
Right. So a child with leukemia is susceptible to infections, especially during chemotherapy, and should be monitored closely for signs of infection. Okay, so that's on page 782. What interventions would you be sure to prevent bleeding in a child with leukemia?
Avoid injury.
Avoid injuries, but how are you going to do that? You don't want to restrict the child. There's going to be a child. They're going to be child. They're going to do what the child wants to do. They're going to run. They're going to play. But what are things that you can do to be sure to prevent any bleeding with a child?
Prevent any bleeding with a child. Oh. Oh, it's to prevent bleeding?
Yeah, to prevent the bleeding. What would you do?
Supervision at all times.
Well, supervision. But some of the other things that they're talking about is like
Avoid shaving?
Yeah, don't use a razor. Use an electric razor, not a regular razor.
For
So
a child?
Well, not for a child, but
Oh, I'm like, I don't know any children that shave their face.
oh, I don't know. I mean, you could have a 16-year-old that shaves.
Oh, I guess you're right. Okay.
Yeah. Use soft sponge-type brushes or gauze will increase the likelihood of injury during oral care. So you want to use a toothbrush that has soft bristles, as soft as you can get, and or use a gauze to brush their teeth. Use mouthwash composed of hydrogen peroxide and saline will help in keeping the mucous membranes and mouth clean, and will not irritate the tissue. Apply pressure to the sites of injections or venipunctures will help prevent excessive bleeding at these sites. Okay.
Okay. I just want to clarify that, Bill, because I feel like so when we prevent bleeding, like for a child with leukemia, so we're not wrapping them in like bubble wrap or anything, but
No.
just like so you're more talking about the like with brushing the teeth, soft bristles, and then if they do have like because knee scratches are unavoidable with little kids or whatnot.
Yep.
So we would put like just apply pressure. That's what you're looking for in that answer. Okay.
Yep. Apply pressure to those areas.
Thank you.
Mhm. And that's on page 781. And what are the signs and symptoms of a child with pyloric stenosis?
Vomiting?
Vomiting is the one, which increases with force and frequency and become projectile. So, I mean, you can be 3 feet away and get hit with the vomit from a child.
Ooh, lucky.
Yeah.
Yeah, it's quite gross. I've seen it. It's not fun.
Like weight loss too? Would that be another symptom?
It would be weight loss because
Difficulty
they're
swallowing,
not being able to
dysphagia.
hold the food down.
Yeah, dysphagia.
So that's on page 799.
799.
Yep. What are signs and symptoms of a child with appendicitis?
What's that
Pain
one?
in the right lower quadrant. And then I don't know what the name of the test is, but if they push on the left and the pain radiates to the right.
I was
correct?
thinking of that too. I don't remember the name. Does anybody remember the name of that?
McBurney's point.
Yep. It's McBurney's point is where you're going to press on. But if you push down, you're also going to, the pain will go
Rebound.
away. But then when you let go, it radiates again. Fever, nausea, and vomiting are common in children with appendicitis. The child with appendicitis may also have abdominal pain, but may have a difficult time localizing the pain. Sore throat, bone and joint pain, itching and swelling around the eyes and ankles, convulsions and weight loss or gain are not signs and symptoms of a child with appendicitis. And that's on page 806.
Hmm.
Okay. What would be the first thing to do if a child has swallowed an unknown poison?
All poison control.
Okay. You
Give them
call,
Induced vomiting.
caregivers should always call the poison control center immediately when a child has swallowed a known or unknown substance. Depending on the substance swallowed, the poison control center will direct the caregiver as to what steps to take next in treating or obtaining treatment for the child. And the number here in Washington State is 1-800-222-1212.
They go as far as calling the hospital as well.
Yeah, but poison control center is a lot quicker and a lot faster than the hospital.
Yeah.
Hospital, you have to go through, if this is a major emergency, hang up and dial 911.
Yeah. Yeah, no,
No,
I mean,
like-
the poison control calls the hospital themselves.
But they will,
They did,
But
yeah,
they know-
in my experience.
yeah, but
Does
poison
nine-
control center knows what to do.
Does 911, like if someone's in a crisis and they can't then I'll be able to look up the number,
Right,
or they remember the number. Can you call 911 and they can redirect you to poison control? Or
yes, they will. They will tell you which way, where to go. And that's nice, they can tell, hey, this is where you go. And they'll actually connect you right directly to it. So that's on page 810,
Thank you.
okay?
Yeah.
What is the first
would,
thing?
Would one quick question on that?
Yeah,
Would how often does like untrained people, are they ever going to be ordered to induce vomiting, or is that just? Has you ever heard of that? That's just out
Yeah.
of curiosity.
sometimes they will tell you to induce vomiting, sometimes they will not. They do not say give them syrup of ipecac anymore. Because you know what syrup of ipecac is? It's a poison that induces vomiting. It's a poison.
What's
Yeah, Trevor?
it's the what then you got the nerve in the back. What is that called again? That you
Oh,
or
you just stick your finger down their throat and make them gag. The gag.
yeah.
So, I'm sorry, Bill, did you say that they don't recommend, I know, they don't recommend that anymore? They don't use that to induce vomiting? I know it's a poison, I just learned from you that it's considered a poison, but, so that's not the recommendation anymore?
No,
I guess I was just thinking about it too, like, depending on what they took down, it's gonna go right back up. It could cause double damage, huh?
yep, it will. Because sometimes they will swallow something that is caustic.
Yeah.
It's an acid, and it goes down inside their stomach and mixes with the acid, the hydrochloric acid that's in their stomach, and it makes it even worse. And if you make them throw up, it's going to burn their esophagus even more, or their mouth even more. So you want to make sure that you are doing what the Poison Control Center says to do.
Hey, Bill.
Yeah.
In the book, it says to remove, by step, remove the obvious remnants of poison, call 911, then call poison control. Are you just asking, in general, what to do if someone swallows poison?
Yeah.
Okay.
Yeah, it's most of the time they say call Poison Control Center, but a lot of people don't know the poison control number. They don't have the Mr. Yuck stickers that they had for a long time, where it had the number on there. So they don't have that out there that much anymore. So they do say you can call 911, and 911 will route you to the Poison Control Center. So, because kids are always doing this, they're always the first thing they do is put something in their mouth, and that's just being a child. That's how they sensorize the world. is
My
by-
daughter ate a half a tube of Desitin,
Yeah, oh God.
and that's like too much zinc. So for the
Mhm.
next 48 hours, she was vomiting, and it was coming out both ends, even in the middle of the night. Their biggest worry, they said, was dehydration. So if it didn't stop, and then
Yep.
it did, it lasted 48 hours, and pretty much like I said, and
Yep. And
Yeah.
that, so, yeah.
Yep.
Somebody said something.
another time she sprayed ammonium in her eye. It was like a tire cleaner in the garage.
Oh, Jesus.
So I had to take her to Mary Bridge, and that's when I called poison control, and they called Mary Bridge. Then they knew I was coming.
Yeah.
And we had to hold her down for 45 minutes, and they irrigated her eye with like 4 or 5 bags of the saline
Mm-hmm.
slowly. It was like an exorcism.
That's where they should take and do nitrous oxide.
They gave her some kind of Versed in her nose spray, and it didn't. She screamed. It was. I'm telling you, it was like an exorcism.
Yeah.
At first,
No.
it was funny, but after 45 minutes, I was crying and praying with her, with the nurses. We were praying for the nurses because, man, whoo.
Yeah, I when I worked at TG, I was partially in charge of okaying people to give nitrous oxide, because you give nitrous oxide to somebody and they don't care what you do. It's like, hey, okay, go ahead, whatever. And I had my first case that I did. I had a child that was held down, given medication, Versed, morphine, all kinds of things to get a post-void residual for her. They had to catheterize her and she wouldn't lay still. Got her on nitrous oxide, and she just laid there and sort of slept the whole thing. The most noise she ever made was when they put in the catheter and she went, eh, and that was it. She didn't move. And you turn off the nitrous oxide, turn on the oxygen full bore, she wakes up in seconds, and she was fine with it. So, I mean, you ever have a child that won't lay still, won't cooperate, get nitrous oxide. I mean, it's so much nicer for the child and for the family, instead of seeing them hold that child down for 20, 30 minutes, where if they give them the nitrous oxide, it's a 10-minute procedure and they're done. So anyway, onward and upward. How would you explain the difference between diabetes type 1 and type 2 to a child? Anybody awake out there?
Hard question, because it's not.
Yeah. What do you?
It's not easy to explain that kind of level of medicine to a child.
Yeah, but you have to. You have to
Yes, of
explain to
course.
that child why it's important for her or him to take insulin, where maybe their grandpa or grandma or mom or dad has insulin and takes pills and only has to take a pill for their
Because with
diabetes.
type 1, the pancreas doesn't work at all, right?
Pretty much.
And the type 2, it works some, and there's different types of diabetes.
Yeah.
If you don't see them in the room, it's 108.
Yeah, they got it. I'll go find it. Don't worry.
So the child with type 1 diabetes mellitus will most likely have to take insulin injections to control her disease. Individuals with type 2 usually are adults, and their disease sometimes can be controlled by taking oral hypoglycemic agents. Most type 1 diabetics will always have to take insulin to control their disease.
Do you have any kids that are also type 2 diabetes?
That is being more and more evident as our population becomes more and more obese. We have more children that are becoming obese at a younger age, and that is causing them to have type 2 diabetes. Type 1 diabetics can go as high as 18, 19 years old for their initial diagnosis. And that, so you have to be able to explain this to the child that, okay, you're going to have to take insulin the rest of your life. And they've got camps for diabetic kids that they go, and every kid there is a diabetic. So they don't feel left out. They don't feel alone. And that, so I mean, it's a great thing to be able to do, is explain to that child that, okay, your grandpa has type 2 diabetes. That's for adults. And he can take pills where your body doesn't produce enough insulin for you to control it. So we have to give you more insulin, and the only way to take insulin is by a shot. But a lot of kids nowadays, they're smart. They're getting on insulin pumps. They only have to inject themselves once a week. You know, they put in a needle, a soft needle in their stomach, and they wear a pump on in their belt, and everything is controlled right there. They don't have to poke themselves as much. They still have to, and even now they don't have to check their fingers as much. You have all these electronic glucose monitoring that checks the interstitial blood sugar, and they correlate it and they get it going, and it's well controlled. So it's a lot better than what it was, 20, 30 years ago. Okay, and like I said, that's on page 814. There's a whole big section on that. 814 is just the beginning of it, I think. What goal would be the highest priority for a child with failure to thrive because of malnutrition? So there's different types of failure to thrive. One is they don't get enough caloric intake, and two, they're emotionally abused.
So address. Oh, the answer to the would it be address the cause for malnutrition?
Right. So if it's malnutrition, then you have to figure out how are we going to get this child to eat. And a lot of times what happens is they have to come into the hospital and they have to be started on a tube feeding or hyperalimentation. And that's a very risky behavior for a young child because they can die from it rather easily. So they have to be that. So
Sorry, I have a question. In this case, and maybe I'm just confusing it, so please correct me if I'm wrong. In this case, malnutrition would mean that are you addressing that they're losing weight, or they're just not getting the nutrients that they need, and so their body,
it could be both. It could be that they're not taking in enough food to maintain a weight, or they are not eating the right type of foods. Okay. So the goal with the highest priority of the child diagnosed with failure to thrive will be maintain and increase their current intake and weight. So that's what the big thing is, and that's on page 790. Okay, what are expectable ways to lower the fever for a child with a UTI?
Tylenol?
Well, you want to dress them lightly. Don't put a lot of coats and a lot of heavy garments on them. You can also, let's see, aspirin is never used to given to children because of concern of Reye syndrome. Sponging the child with cold water is not recommended. as a method of lowering the elevated temperature. A normal body temperature for an infant should be in the range of 97.6 to 99.3. So a temperature below 97 would be too low, okay? So page 828. What is the important intervention on a child with nephrotic syndrome?
What syndrome?
Nephrotic syndrome.
Oh, nephrotic.
Yeah. So it's kidneys.
Right. What was the question again, please?
What is the, got to get back on the page. Answers on one page and the questions on another. What are the important interventions for a child with nephrotic syndrome?
Corticosteroids
No,
and immunosuppressant therapies.
it's something very simple.
Can you ask the question one more time, please?
What is an important intervention for a child with nephrotic syndrome?
Hydration, like lots of fluids.
Well, you're going
Weighing them every day.
Huh?
Weighing them every day.
Yep,
on the same scale.
weighing them every day using the same scale. Okay. Same scale to accurately monitor the fluid gain or loss. The child with nephrotic syndrome is usually on bed rest. Fluids may be retained and therefore are not increased, and urine is tested for albumin and specific gravity. So page 832. Okay, another kidney question. You guys should be getting these right. You just had Eileen with her kidney stuff, right?
No.
Not yet? Maybe that's this week? Well, that's right. It's that Andy, Bryce said it was this week.
Yeah.
Yeah. What a child diagnosed with acute glomerulonephritis, what would be the historical cause for this disease? What causes glomerulonephritis? Acute.
Streptococcal.
Say that again, Inga.
The A beta hemolytic streptococcal infection. Did I make that up?
No. It says symptoms of acute glomerulonephritis often appear 1 to 3 weeks after the onset of streptococcal infections, such as strep throat, a sibling with the same disease, hemorrhage, or history of easy bruising, and hearing loss with impaired speech are not commonly associated with glomerulonephritis. And that's on page 831. So what foods are high in sodium? What foods high in sodium that would not be given to a child with nephrotic syndrome?
Belly fries.
Hot dogs.
Hot dogs, yeah.
Heavily processed foods.
Heavily processed food, yes.
Cup of noodle.
They said dairy products.
Dairy products.
Yeah, like milk, cheese, butter.
Oh yeah, cheese does have a lot of sodium. Yes.
Yeah.
Yeah, they use this preservative, so yeah, definitely it's gonna and flavor enhancing.
Right. And then some grain products are higher in sodium than fruit, apple juice, or canned peaches, and fresh vegetables, green beans, things like that. This is on page 832. And caring for a child with UTI would be the highest intervention for the nurse to perform.
If they have what disease? I'm sorry.
They have a UTI.
Oh, a UTI. Okay.
What is the highest intervention for the nurse to perform?
Oh.
Fluids.
Nope, not fluids. Before the
Infection
fluids.
control, no, fever control.
Nope.
Hypothermia.
Nope.
Educating.
Nope. Okay, you guys
Front to
ready?
back.
Yeah.
Clean cut.
Urine.
Nurse would collect the clean catch void urine specimen before
Oh.
any treatment is started to increase the likelihood of being able to identify the bacterium causing the infection.
Okay.
Stop. That was a tough one.
Yeah, it's the simplest thing. You got to get a
Yeah.
urine specimen first.
Right. That makes sense. 'Cause it-
You got to
it-
know what is
Yeah.
causing the UTI so they
Right.
can prescribe the right medication. So that's what that is. See, you guys thought of all these other things, and it's like, yeah, you want to do that, but first thing you got to do is this over here. You got to get that urine specimen first, and that's on page 750. How much fluid would be needed for a child to have that has sickle cell disease? And I gave you that answer here a few minutes ago.
2,000 to 3,000 mLs.
Yep. It says prevention of crisis is the goal between episodes. Adequate hydration is vital. Fluid intake of 15 to 2 liters a day is desirable for a child weighing 20 kilos and should be increased to 3,000 a day during the crisis. So a minimum of 15 to 2,000 for a kid that weighs 20 kilos. That's about 42, 44 pounds.
So can I ask what I don't want to guess at why the fluid is crucial, but I think I understand it because of it's to include well, I think I know why, but I don't know how to articulate why this is so crucial. Part of it, the thing that comes to my mind is how the blood thickens and the shape of the of the cells. The increased fluid would allow, what? I don't know. It makes sense, but I don't know how to.
Yeah. Well, the hydration is important because if you don't have enough fluid in your body, when you become dehydrated, what do you notice? Your blood vessels that you see in your skin flatten out. They're not as full. So they're not as full, so they're not as round, and they're not as pumped up. So the sickle cells are able to clot off areas that normally they would be able to squeeze through.
Oh, that makes sense. Okay, thank you. Yes. Okay.
Okay.
All right.
Okay, a child diagnosed with idiopathic celiac disease would require what type of foods?
Low fiber.
Obviously not grains. Fruits maybe.
Yeah, they wanted a young child should be started on a starch-free, low-fat diet. Okay, so that's where you're gonna stop that celiac in its tracks. You would have to not use regular flour.
Gluten-free, low-fat diet. Okay.
Right. So that's where they're going to be started at. And that's on page 793. Okay, we're almost done here, folks. What are the signs and symptoms of a child diagnosed with intussusception? Intussusception, that's what it is.
Oh, I know that somewhere in the back of my brain.
Is that INT?
Yes.
INTUSSUSCEPTION. Intussusception.
Don't tell us. Hold on. We're looking it up.
Okay.
So what was the question? What are some of the manifestations?
What are the signs and symptoms of a child diagnosed with intussusception?
Pain.
Cries out sharply, draws up the legs, and the severe colicky spasm because of the pain. Is that right?
That can be part of it right there, yes.
Oh,
I mean, that's
okay.
one of the things. A child with intussusception, the stools consist of blood and mucus, thereby earning the name currant jelly stools.
Oh, yeah, I see that. Ooh.
There is a telescoping of the upper portion of the bowel slipping over the lower portion. So it's like this is the upper bowel, and the smaller bowel goes right inside it. So you could think that your gut does not have pain receptors. Your bowel does not have pain receptors. I could take a bowel out and cut it, and you wouldn't feel it. But
The bowel doesn't have pain receptors?
nope. But if I stretch it, you've had gas pains. Everybody's had gas pains, right? And you know, and that's because the bowel is stretching, and that they do have stretch sensors, and that causes pain. So the condition occurs more often in boys than in girls, and the highest incidence occurs in infants between the ages of 4 and 10 months. Infants who previously appear healthy and happy suddenly become pale, cries out sharply, and draws up the legs. So that's where you were talking about that one. And a severe colicky spasm of pain. This spasm may last for several minutes, after which the infant relaxes and appears well until the next episode, which may occur 5, 10, or 20 minutes later. So page 805 is where it's at. What are the signs and symptoms of acute glomerulonephritis?
Oh, I just had that. Where is it? Go back.
Signs and symptoms?
Yep.
Glomerulus.
Bloody urine, fever, and headache.
Oliguria?
It's
wait,
usually...
wait, hold on. I just found it.
Okay.
831.
831, page 831.
Okay, so, it appears to, what was the question? What are the signs and symptoms?
Yep.
Okay,
of acute glomerulonephritis.
Grossly bloody urine.
Yep.
Slight headache and malaise.
Right.
And hypertension.
And periorbital edema.
I saw that. Yeah, let me highlight that.
Fever may be 103 to 104 at the onset, but decrease a few days to about 100 degrees. Slight headache and malaise are usual, and vomiting may occur.
High specific gravity with
Yeah. So that's it for the test, folks. We just basically went over the test.
So you're gonna post that study guide?
Yep, I will post
you.
that study guide so you guys can look at it.
Cool.
So Bill,
Yes, ma'am.
it sounds like most of these questions are based off of like diseases or like syndromes and stuff like that.
Correct.
Are there any that are not really based off of that? Or, I mean, did we just kind of go over everything that's going to be on the test?
We just went over everything included on the test.
Sounds good. Thank you.
So you guys do, I've done the most I can do except give you the answers to the test. So
thanks, Bill.
All righty.
Thank you.
Thank you.
Okay, I'm going to record the first 3 questions now. So, what causes rheumatic fever? Rheumatic fever is precipitated by a streptococcal infection which may be undiagnosed or untreated. The disease is not hereditary and is not necessarily seen in family members. Easy bruising and increased urine output are not symptoms seen in rheumatic fever. Page 768. Signs and symptoms and complications of tonsillectomy. Bleeding can occur 5 to 7 days after surgery. And is often noted by frequent swallowing. This is a concern and should be reported immediately. Sore throat is common for several days after surgery. If an ice collar becomes uncomfortable, it can be removed. Vomiting, dark, and old blood may be expected within the first 24 hours after tonsillectomy. Page 740 in the book. Okay. What child with a fever and decreased urine output, what would be the nursing intervention? And it's thinking dehydration can be a concern for a child with a fever. Therefore, the highest priority would be increasing fluid intake to help in prevention and dehydration, reducing anxiety, allowing caregivers to talk about their concerns, and promoting adequate caloric intake would be appropriate for a child and caregiver, but they would not be the highest priority. Page 797. And I think this was a repeat, but what are things done to prevent asthma attacks? Children with asthma should be encouraged to exercise using moderation. They should not become extremely tired, and activities should be spaced to provide for periods of rest. Statement about identifying allergic reaction or triggers, using bronchodilators before steroid inhalers, and drinking water to thin secretions indicates the caregivers have an understanding of treatment important for their child with asthma. Page 745. Okay, so that's the end of that, and we're done. Enjoy your weekend, guys. Relax. Stay, take some time for yourself.
Thanks, Bill.
Thank you, Bill.
Uh-huh.
Thank you, Bill.
Mm.
Hey, Bill.
Yeah.
I have a quick question. So
Oh,
the
no.
Charlie, it's about clinicals.
Just a second. Let me stop the recording.
Okay.